Hello, I'm Sloan Clark, the Reference and Instruction Librarian at Flipper Library, and today I am doing a recording of a LibGuide on COVID while Black. Um, I decided to create this web guide, LibGuide, because I wanted to have a documentation of some of the events that has happened to African Americans due to this pandemic. The COVID-19 guide is of the effects of the pandemic on the African American community. Black folks can't get corona, or so they say. That was the mantra that was put out there by even some NBA players. They thought that African Americans could not get COVID. According to the CDC, COVID-19 is spreading rampantly in the African American community. In New York City alone, the rates among Black or African American persons is 92.3 deaths per 100,000 population. Hispanic Latinos is 74.3, is higher than whites, which is 45.2, and Asians 34.5. Studies are underway to confirm these data, but right now, according to the death rates, African Americans in New York City and other major densely populated cities are of higher rates than other minorities. COVID-19 hits hardest in African American communities. African Americans are hit the hardest, according to states statistics in Michigan, Louisiana, Chicago, and Milwaukee. Most African Americans are hit hardest because we are essential workers. Black workers are essential. Most Black workers are in the public eye, which means they work in the public, like grocery store workers, people who work in, the transportation industry, like bus drivers, and of course on the front lines in the hospitals with nurses and CNAs. Many African American workers were essential workers in this COVID-19 fight. Many African Americans were also asked to stay at home, but they couldn't stay at home because they needed to pay rent and other bills. The non-essential workers were people who did not have to go to work during this pandemic. Many of them, like myself, were lucky enough to have jobs where they could stay at home and do their work. But many African Americans did not have that luxury. And the few that did, it was found that less than 30% of them could work from home because they did not have connectivity. Connectivity meaning they did not have access to the internet, did not have access to maybe they didn't have a computer, or they didn't have access to maybe a laptop or a PC at home. Many African Americans, unfortunately, do not have the means to connect at home, and they have suffered in workplace productivity. Many of those workers may have been laid off because they could not access their workplace from home. As statistics shows that less than 1 in 5 Black workers and roughly 1 in 6 Hispanic workers are able to work from home. If you were one of the lucky ones that could work from home, then they did not include those people in the statistic. Also, when it came to connectivity, remote learning, there were gaps in remote learning. Many HBCUs students did not have access to laptops. They did have smartphones, but smartphones limit you to connectivity. Many of the African American students at HBCUs or either PWIs could not keep up with their work because they did not have connectivity. Now they are talking about social distancing. Social distancing is very important during this time. You need to be 6 feet away from each other. The unfortunate part about this is that in New York City and other major cities, a lot of the police officers are fining or arresting African Americans. I have some video clips here on African Americans being apprehended or brutalized by the NYPD Just to give you a heads up about the video, it's very disturbing to say the least. But social distancing while black is just like another thing as shopping while black, driving while black. We are being more scrutinized if we are in groups of 3 or more, if we're not socially distancing, if we're not wearing a mask. And even if you're wearing a mask, black men say they are scared of being, it invites racial profiling of them. And so a lot of black men fear wearing a mask. The New York Times did an article in April about black men fear that masks will invite racial profiling. And the CDC recommends that everyone cover their faces, including African Americans, because we are hit the hardest. And also the another effect of this is the testing. There are 2 different types of tests. There's the corona test, the corona COVID-19 test, and the antibody test. So there are 2 tests that African Americans unfortunately are not getting access to. The video I have is African Americans urged to get tested. In this video here, Magic Johnson is on this video talking about how testing was important when he was discovered that he had HIV. And as you know, HIV is another disease that has hit the African American community. I'll let you take the time to look at that video. It was very interesting how he went back 30 years into his diagnosis of HIV and AIDS, and then also what's going on in the African American community with COVID-19. There's some similarities when it comes to testing. Many African Americans who have died during this period could not get access to a test. And our communities, unfortunately, we don't have the best hospitalization, or we don't have the best clinics in our community. And also many African Americans, as you see now, don't have health insurance. So this is very, very critical for us. The last but not least is another effect of the COVID is contact tracing inequities. There's not much literature on this. I did find an article about the importance of equity in contact tracing. You can take a look at this article. But the thing that caught me was this quote, first, low-income people and people of color live and work in spaces in which contact tracing apps may be more likely to generate false positives. And what they mean by that, from what I read in the article, is that African Americans live in high density populations. So that means they probably live in an apartment. So if your neighbor or someone, maybe even not your neighbor in the same complex, has the COVID, it will show that you have the COVID because you live near someone, or you've been in contact with someone who has COVID, whether it's on the elevator or it could be in a common area in the apartment complex. So if most African Americans and minorities don't have, independent housing, they'll have their own homes. So they will be more likely to be shown as having contact. So that's another way of profiling low-income people and people of color. I hope you take the time to look at my LibGuide that I created. And this is one of many LibGuides or many documents that are being put out there now by universities and public libraries about the effect of COVID in the African American community. Thank you.